breakfast?
So today I cooked omelette. I had eggs and bread for my breakfast.
All right. You had like a healthy breakfast today.
Yeah, healthy plus easy to make breakfast.
Hmm, good that you are in the healthy lifestyle.
Mhm.
So let's start by telling me a little bit about yourself.
Sure. So, first of all, Dr. Vijay and Dr. Samyukta, thank you so much for giving me a chance to get interviewed at your program. I am really excited for that and a bit nervous at the same time. So, talking about me, I am Ayushman Gupta, medical graduate from Government Medical College, Jammu, India. At present, I'm staying with my family in my hometown, Jammu, which is a small town in northern India. And I'm serving as a medical officer at a hospital in my city. After graduating, I had a chance to work in various healthcare institutions across my city in urban, suburban, and the rural areas. And recently, I finished my 4 months of United States clinical experience. During third year of my medical school, as a part of my voluntary work, I was a state coordinator for Medical Student Association of India, Jammu and Kashmir. So yeah, that's my professional life. Now talking about my personal life, during my free time, I love spending time with my two niece, and I am a dad to my 2-year-old Labrador Ginger A Gupta, and definitely I love spending time with him as well. Secondly, is that during my free, I like going to the gym or swimming because that keeps me active and healthy. Thirdly, I love cooking Indian food as well as sometimes I try international cuisines as well. Lastly, I run an Instagram page by the name of Mexagram, and through that page, I'm able to connect to 1,800 medical graduates. And on that page, I share snippets from my USMLE journey. And so far, I got a chance to mentor 50 students. So yeah, that's me in a nutshell.
Oh, that's good to hear about you that you are even cook Indian food. Can you tell me what type of Indian cuisine you cook more about it?
So so I just try to cook easy recipes that are healthy and tasty at the same time. So I love cooking butter chicken, chicken tikka. Then I even cook naan at home, the naan bread which is famous across the globe. So yeah, I try different type of Indian cuisines. Right now, I'm learning more and more of Indian cuisines. But definitely, once I'll be learning much of Indian food, then I'll be shifting to the international cuisines as well.
Awesome.
That's yeah.
Mhm.
Yeah, go ahead, Dr. Vijay.
No, no, keep going. Yeah.
Dr. Aishman, what were your favorite subjects back in medical school?
So my favorite subjects were my favorite subject in my medical school were gynecology and obstetrics and and medicine. So these were my two favorite subjects. Because,
And I'm
Mhm.
assuming, yeah, please go ahead. I'm sorry I interrupted you.
No. You please go ahead, Dr. Samukta.
Okay, so I'm assuming you're applying for internal medicine residency program with us, right?
Yeah.
So, is
Internal.
it that you choose internal medicine over obstetrics and gynecology among your favorites?
Mhm. Yeah, so definitely I mean to say that I like the subject, but definitely internal medicine, I definitely like it any day over any other branch. That's my love for sure.
Okay, what draws you towards internal medicine?
So, firstly, my granddad, who's no more, like, he was diabetic for 20 years, and he was being managed by internal medicine physicians for all during his diabetes when he was alive, plus whatever major surgeries he had during that point of time. So, definitely that was one of the inspiration that drew me towards internal medicine. Then, after in my medical school, I developed my inclination towards internal medicine. The things that I like about the internal medicine, I would say, would be firstly being an inquisitive person. I really like that when you're working in a hospital, you don't know what kind of patient you're going to get in the next bed. So that gives you a chance to, start from scratch, take the history, examine the patient, perform diagnostic tests, and then we can come to a diagnosis. And after that, we can formulate a treatment plan, and if required, we can refer the patient to a required subspecialty as well. Secondly, internal medicine gives India. I think the internal medicine would give me a chance to have long-term relationship with my patients. I'm somebody who likes to have long-term relationships with his family and friends as well. Third would be, I really like about internal medicine is that it's very flexible. Like it gives me a chance, like if I want to work in a clinic or a hospital, or even if I want to do a specialize in particular subspecialty, and I can practice in that as well. So that's why internal medicine is something I definitely want to take up that in future.
That sounds good, Dr. Aishman. So, is there a particular subspecialization that you're interested in after the 3 years of residency over here?
So, Dr. Samyukta, right now I don't have anything in my mind. In my near future, I see myself working as a hospitalist, maybe for some years, and adding more to my knowledge. And after that, I just plan to have my own clinic. But definitely, I'm open to new opportunities as well, because I think as we move ahead in life, we learn from we get to experience new things, and I am open to anything in future as well. But at present, nothing in particular.
Okay, okay, that sounds good. So you're pretty open to embracing the field as it comes and then take one step at a time. That's good to me. Okay, so so far, tell me something more about your clinical rotations. I believe you said you had 4 months of clinical rotations in the United States. So, what kind of rotations were they, Aishman? Were they hands-on or were they observerships? I would also like to know what kind of cases you saw here so that I can gauge what skills you have developed so far in the US system.
Right. So this year, Dr. Samyukta, I traveled in April into United States, and I landed in US with just one rotation. But after that, I interacted with more and more medical students, even the medical graduates as well, plus my attendings, and I started, reaching out to people through emails. So in that way, I got three more opportunities, and I got to do my 4 months of United States clinical experience. I started at a hematology oncology clinic in New York, in Brooklyn, New York, and over there it was my first experience in the US healthcare system. So that definitely added to my communication skills. Plus, I had used EMR in the US healthcare system for the first time. Then after that, and it was a hands-on experience. Like I had a chance to take history, examine the patient, as well as discuss the treatment plan with my attending under his supervision. Second was I got a chance to rotate at a teaching hospital, St. Peter's University Hospital near Brunswick, New Jersey, where I was a part of team of my attending residents and the medical students. So that experience taught me the importance of the teamwork, that how a team can, give its best to treat the patients in a hospital, and the multidisciplinary and the holistic approach that the US healthcare system has. Third, then I rotated with my gastroenterologist attending at HSHS St. Mary's Hospital, Decatur, Illinois. Yeah, so over there, apart from taking history examination as well as going on a hospital rounds, I had a chance to observe about 100 colonoscopies, endoscopies, and even capsular endoscopies done by my attendants. So at last, I shifted to Dearborn, where I rotated at Patient First Clinic under my internist attending. And over there, I had exposure to addiction medicine, where I got a chance to, read the urine drug screens, and even after that, discuss it with the patients and even counsel them. And I even got a chance to be a part of the televisits, where I used to, interact with patients telephonically. So that was a different experience I had. So that's my United States clinical experience in a nutshell.
That's pretty amazing, Dr. Aishman. So, okay, so it looks like you've had a mix of both outpatient and inpatient experience, which is really amazing. So, which one of these has been your favorite clinical rotation and why? Give me your reasons.
So out of this, my favorite the rotation was my one at St. Mary at HSH St. Mary at St. Mary's Hospital, Decatur, Illinois, when I was rotating under gastroenterologist attending. It was special because first time I got a chance to observe the procedures as well. Because in all other rotations, I had a chance to see the patients, they interact with them, take their history, examine them. But it was the first rotation where I got to observe the procedures as well, right? I
Okay.
really liked, how the doctor used to take the consent first. Every time, used to go for the procedure, or even in his office, he used to ask the patients whether the patient is comfortable with me being in the room, right? And then he used to teach me a lot of things. Like every day, he used to give me interesting topics from gastroenterology, and next day we used to discuss that.
Okay, so you were quite intricately involved with each of these rotations. That is a plus. That's a big plus for us.
Mhm.
So, how do you think the US healthcare is different from the healthcare in India? I'm sure that you've had greater experience in India, but out of the four rotations that you've had in the US, what do you think you can point out as a few of the differences?
Sure. So, working for 2 years, and currently when I'm working in Indian healthcare system, and recently I did my 4 months of United States clinical experience. The differences that I observed were, firstly, I would say the India being the largest, country with the largest population across the globe. So the doctor-patient ratio is comparatively low compared to US. So in US, doctors spend comparatively more time with the patients. So,
Okay.
so that would be first difference. Second difference would be the difference in the health literacy. In India, the health literacy is variable. Like you get the highly educated people who are well aware of their health and they want to take care of their health. And to the people you will get to interact with people whose health literacy is low. So in that case, the doctors have to take an initiative to make the patient understand that they need to seek a help. They need to seek a help and they get treated as well. But in US, what I have seen, like, while working in the hospital as well as in the outpatient department, is that people, are well aware about health and they are concerned about the health as well. So they have many questions to ask to the doctors as well. So that would be the second difference. The third difference I feel that is in US, the waiting times to go to a doctor are comparatively longer than in India. In India, if I want to go and meet a specialist, I can do that even next day as well in most of the
That
cases.
yes, yes.
And in the
So
last difference, I would say is that in US there's a proper structure. That first you have a primary doctor, then you go to that doctor, he'll assess you, and then he'll formulate a treatment, and then he can refer you to a required subspecialty. But in India, we don't have that proper structure. Like we can have directly an access to the specialist. So many a times, people who are from a non-medical background or who have a whole low health literacy, they don't know who to approach for a particular problem, which doctor to approach for a particular problem. So I just feel that there should be a proper structure in the healthcare. So these are the four differences that I have observed so far.
that's good. That's good, Dr. Aishman. So I think I'll hand over to Dr. Vijay because he has to leave earlier. I have a lot of questions for you, but let him be done
Sure,
first.
sure. Thank you so much,
No,
Doctor.
no, I think you can keep going. You're doing good. You're much better than me. So yeah, keep going. I'm listening. I'm taking notes. Yeah.
Oh my, Aishman's answers. Okay, cool. So, okay. So, Dr. Aishman, so far, what has been your most interesting case out of all that what you saw in India and the US?
Mhm. Right. So yeah, definitely, I have a chance to see many interesting cases, but the one that was most special was the recently in my hematology oncology clinic in Brooklyn, New York. I got a patient, and when like he was the patient was there for a follow, but then we went like me and the other medical student, we went through his history and examination through the EMR system. So we just got to know that few months back he had a urinary tract infection. Then he presented to the emergency department. Over there, a CT abdominal was done, and a retroperitoneal mass was, a incidental finding. Then after that, he was referred to the oncologist, and after which a biopsy was done, which showed that uh, uh, biopsy was done, which showed that it was a squamous cell carcinoma and it was positive for HPV P16, which is a high risk group of HPVs. Then after that, they now it was a secondary mass. Now they try to look for a primary mass as well. And for that, they referred the patient to an ENT doctor where the complete examination was done. Then even endoscopy, colonoscopy was done, and then patient was referred to gynecologist as well. But they couldn't find the primary source. So basically, it was a secondary carcinoma of unknown primary origin. But then after,
Wow.
yeah, so after that, we discussed it with the attending and we just requested him if he can do a case report. So me with my team of other medical students, we started doing the literature work, and we just got to know there are only 7 case reports on the retroperitoneal carcinoma tumor of unknown primary. So yeah, we just contributed to the existing literature through that, and it's very good, working in a team, and we just submitted it to the AMA research challenge.
That's amazing. That is really interesting, and it's a rare pathology that you across. That is, yes, that's really nice.
Mhm.
Uh, all right. So, have you had interest in research?
So, Dr. Samyukta, yeah, definitely, I think that in like I should, I definitely want to have some exposure in research. But if you ask me, I prefer more to, I prefer more treating my patients. Like I'm a more clinically oriented person. But definitely, if given a chance, I want to be part of research and add to the existing literature. Yeah.
Any research experience so far?
Yeah, definitely. I started having a research experience very late in my career in medicine. So recently, I got a chance to publish few case reports, and I even through my connections, I was a part of observation study as well, a retrospective observation case control study.
Okay, that's amazing. So what are your, okay, tell me a time when you probably ran into a conflict with a team member or with a patient or any kind of conflict, and how did you resolve it?
So, as I can recall an incident that, when I was working in a private hospital in my city, at that point of time, I, had a colleague over there, and, I just observed her for at least 15 to 20 days. And every time, whenever, I just observed that she never used to finish her work in her shift, right? So all that work used to come to my shift. I had to do that work apart from the work that I had to do in my shift. So slowly I was realizing that I was feeling overburdened and I couldn't finish. I was overburdened and tired at the same time. Okay, and I just thought that I have to give my 100% to the work that has been assigned to me, right? Maybe, yeah, I tried my best to do her work as well, but it was definitely some additional work. So then after that, I just had interaction with her. I made sure that it's a non-confrontational, non-judgmental conversation, because I don't want the things to escalate, right?
Right.
So I just had a conversation with her, and I raised my concerns with her, and I mentioned that I am feeling very overburdened, and I'm not able to even complete my work, and I think that is hampering the patient care as well. Then after that we had a little bit of conversation where we came to the common goals, and that way we were able to resolve our conflict.
So was she able to mend herself accordingly after that?
Yeah, then she definitely improved, and I told her as well that if you need any help, you can anytime ask me, and I would love to do that. I would love to help you out.
Amazing. All right. So, what do you think would be the challenges in internal medicine in the near future
Mhm.
for internal as a specialty?
Dr. Samyukta, that's a very, very interesting question. So, the challenges that I feel internal medicine is going to have in upcoming years would be firstly, in developing countries, since there has been irrational use of antibiotics, so there is an upcoming antibiotic resistance. So, in near future, we'll definitely see the diseases, infectious diseases that were controlled in past. With those antibiotics, they will be upcoming, they'll be emerging again. So, it will be very difficult to control those diseases as well. Second, I would say is that as a lot of research is being done, and a lot of new and data is and a lot of new papers are being published. So I think the complexity of the chronic diseases is going to become very difficult, right? So it will need the interdisciplinary participation to treat those chronic diseases.
Okay. All
Second,
right.
third, I would say is that you have the AI in place. That is definitely making an entry into the healthcare. So definitely that could be a chance, since we don't know that how it is going to impact the healthcare in the long term.
True, true. Look, like we these are definitely upcoming challenges, and yes, we will have ways to deal with them and to take our specialty further up ahead. That was, yes, that is so true. And then let's see, what else can we talk about? Tell me your strengths. What do you get to my program?
Uh, so like the three strengths of mine would be, firstly, I'm a very adaptable person.
Mm-hmm.
During my 4 months of United States clinical experience, I used to change my home every 30 days. Like I used to pack my suitcase, then start from scratch at a new place, which I used to call my home, at the starting of a month. So in that way,
Right.
I'm very adaptable. Second, I would say is that I don't shy away asking for help, because I
Okay.
acknowledge the fact that I'm not a superhuman, and still there's a lot of place, to learn. So
Yes.
that way, I don't shy away asking for help, and at the same time, I don't shy away helping people out in the best way possible.
Okay.
Third, I would say is that I am a inquisitive person. So I'm very
Mhm.
curious. Like I love interacting with new people, learning about their culture, new foods as well. So yeah, that way I'm a very easygoing person. I can make friends very easily. So definitely my adaptability. Secondly, my inquisitiveness, and third would be I don't shy away asking for help. Would be my three big strengths.
Okay. So, do you think you can swim through the rigors of residency with your strengths?
Yeah, I think I will be able to go through sail easily through the tough times during the residence. Definitely.
Yeah, that's good to know. So, you said you loved trying out different foods apart from. I mean, that was probably one of the things you were inquisitive about while you were in the US, which has been. So, what do you think was your favorite cuisine in the US when you were here?
So in the US, I definitely tried the new foods. I don't I'm basically I just love my Indian food, which we call as desi food in the local language, right?
Okay.
I'm not very used to eating the international cuisines right now, but in US, I definitely tried mac and cheese, the American burgers, pizzas as well, and definitely I even got a chance to try the Indian food in US.
Oh, okay.
And
Okay.
I just made sure that all my friends, whether they are American or some other different part of the country, they even got a chance to try that Indian food as well. So I used to take them to restaurants, and over there we used to order butter chicken and naan for sure every time, and they loved it. I even used to cook food for them as well. Sometimes I used to cook biryani, sometimes butter chicken, and even I used to make Indian tea as well for them.
Okay. So, in the place where my program is located, from what I know from my Indian colleagues, we do not have a lot of Indian restaurants out here.
Mhm.
Uh, See, there's a dearth of Indian grocery stores as well. Do you think you'll be fine with the on the food aspect?
So yeah, Dr. Samyukta, definitely. I know that when I was researching your places in your around your program, definitely there was no Indian restaurant I could find. But I don't think that would be a problem for me because I love cooking food. I can cook all the Indian food, and even whatever materials are available over there, whatever food items are, I can make something out of that which will be edible, and I think little tasty at the same time. And
I'm
I've asked my mother, my parents to send me all the Indian masalas. They'll ship that to US if I get a chance to work at a residency program.
Anyway, since you're adaptable and flexible, I think I and my team are going to work on getting you used to American way of food too. Our food is
Of
also
course,
good. It's
of
not bad.
course. I love it. Like I love mac and cheese, American pizza. Definitely, I love it. And I would, apart from that, just not cooking food only for me, but I would definitely love to cook food for you guys as well.
We would love to have that too. So, on the flip side, what could be one of the weaknesses that you have that I need to know as an assistant program director?
So, Dr. Samyukta, what I acknowledge is that I am I'm a people pleaser, and I find it very difficult to say no to people,
Mhm.
right? So, there definitely many times I realize that fact. It puts a lot of burden on me, right? And I'm not able to give my 100% to the task I'm performing. So many times, my family and even my friends tell me the same. They tell me that Aishman, you should learn the art of saying no to people, right? Because you can't be doing everyone's work, and you can't be helping everybody out. You need to prioritize your work and give your 100% to what you're doing. So
Okay.
I just acknowledge that fact, and I'm trying to improve on that. Like I try to go through some YouTube videos as well. Plus, I even talk to my few of my friends about that as well. So that way, I am trying to get over that.
Okay.
Mhm.
Okay. Yes. Yes. The art of saying no is important in life and in our career as well.
Absolutely.
So, as a as just something which I would say, probably as a follow-up question with respect to patient care,
Mhm.
if you come across a patient with who's being diagnosed with pancreatic cancer while an inpatient, how would you approach the patient?
Mhm. Right. So
How
definitely,
would you the
yeah.
diagnosis, and what would your words be?
Right. So yeah, if I have to I disclose about a pancreatic patient cancer to my patient, definitely it's a very sensitive issue, and patient can have a major mental trauma because of this. So I will make sure that whenever I go and I'm about to disclose that to the patient, first I will start a general conversation. I will just even talk to patient that how he is feeling, and even his or her family members as well, and I will have a little bit of discussion with him, so just to lighten the mood. Then after that, slowly and steadily, I will. In a subtle way, I'll be telling the patient that I am here to disclose something which is bad, right? So that he can be mentally prepared for it. And then I would, like, very, well, and then I would have to disclose the news to the patient for sure.
Okay.
Mhm.
Okay. So, say you're thinking about hospice care because this is stage 4 pancreatic CA, and his lifespan is limited. But suppose his family wants you to give him continue giving him medical care and not tune him into hospice care. How will you say no to the family, and how would you deal with such a scenario with in the acting in the best interest of the patient?
Sure. So definitely, I'll have a conversation with the family, and I will, firstly, I would like to know their point of view, that why they are thinking, that why they want to
Hmm.
continue with the medical care, and what is the understanding of the disease to them. Like, do they
Hmm.
understand how critical stage the cancer is at? Right?
Hmm.
I will definitely, tell them. I have a discussion. I'll make them understand, and if required, I can even just show them some literature on the mobile as well, right? And I'll
Hmm.
try my best to convince them. But definitely, if it doesn't happen, then I will have to maybe approach some hospital board or one of my seniors for help.
Okay, this part just research it a little bit. Okay. Ah, not as the APD, I'm just telling as a friend now. This part of it, just do some research on it. I don't know. I think you will first have to ask the patient what he wants to do, and if he chooses hospice care, then you will probably have to say a no to the family bluntly after all the counseling, in case the counseling doesn't work.
Okay.
This is what I think, but just confirm the answer. This the reason I said this is a follow-up question is when you say you have difficulty to say no to
Mhm.
people. There are times in our careers also we have to say no to patients and their, so they would just want to ensure that this does not interfere with your patient care. That's
Right.
it.
Right. Right.
So what are your hobbies? I'm sorry, I forgot what are your hobbies apart from cooking.
Okay. So apart from cooking, like during my free time, I am a dad to my 2-year-old Labrador. So definitely, I love spending time for him, like maybe feeding him or taking him for walks. Then we have a big garden in our house. I just let him free over there. He just runs and plays. I sometimes play even football with him. So
Okay.
he's a part of my soul. He's very, very important to me, right? So through him, maybe that's my first exposure to the motherhood,
Oh
right?
wow.
Yeah. Then apart from that, I just try to be regular going to gym or swimming depending on the season, because I just think that keeps me active, not only physically but even mentally as well. So in my free time, I just try to create some content for my Instagram page, and definitely, I have a family of 1,800 people on Instagram, and I do get regular messages, so I have to answer those messages as well. Plus, during my free time, I take mentorship sessions as well. So yeah, that would be my hobbies apart from cooking.
Oh, so you are already a famous personality then. That's
I
great.
I cannot guarantee that, yeah, but I just try to help people out through my page.
That's amazing. That's amazing. Yeah. I think I'm done with my questions. What else can I think of? What questions do you have for me?
Uh, so yeah, Dr. Samyukta, it was very insightful talking to you and getting interviewed by you. That's my pleasure. Pleasure is all mine. But I just want to ask you, like, how do you evaluate your residents?
How do I evaluate my residents? So we have monthly feedback scoring systems,
Okay.
but both a mix of formal and informal feedbacks. For
Mhm.
the feedbacks, whenever we meet, I meet my residents on and off, then I tell them the feedback. Do you really want me to go on?
No, no,
I
no,
can
no.
tell.
Right. No, no, no. That's fine. You can just give me a feedback. First question I want to ask about that, when you told me how would you disclose it to the patient, I just solely, talked about how I had a question on you world. There was a question and they told that, you have to prepare your patient first by, telling them that you're going to disclose something bad in a subtle way. So that the patient is mentally prepared and then you can break out the news to the patient. So that is what, in that way, I just answered that question.
Yeah,
But
so so most of the times the thing is either with one of the scans, so ultrasound, CT, MRI, with one of those scan reports, we would be back to the patient, right? So my first question to the patient is, because we would have discussed the differential diagnosis with him before the scan report actually comes. I mean, before we take him for the scan, also we would let him know why we are doing so and so investigation. So once the report comes, my first question will be, how much do you want to know? And then I'll take it from there. And then I'll ask about, when the right time comes, I would ask him if he would like to involve his family or who does he want to involve in his care. And I will take it to his family. Now, if it is hospice care that the patient wants and that we also want for the patient, and if the family thinks otherwise, I will try convincing the family first. But if they do not understand, then I would tell them that I will be respecting the patient's wishes, and hence I will say a no to the patient's family.
okay. So, Samita, I was having a mock with someone, right? So at that time, he told that Ayushman, you don't have to say a no. Like he asked me a question, like if you're working in a nursing home and somebody with a stage 4 cirrhosis of liver asks you for alcohol, right? How will you deal with that situation? So he told,
Ask,
then I just answered the same. First, I'll try my best, have a conversation with the patient. I'll try to convince him. But then when he asks me, no, I want alcohol, then I'll say him a no, right? Because I have to. That's my duty to give him the best treatment, right? Then he told that Ayushman, you have to be diplomatic in this answer. Don't say directly a no. You can just say after that, I'll do some literature review, then I'll talk to my team, and whatever my team, we come to a common consensus, and that I'll proceed with that.
yeah, because that in that scenario, it is only the patient who is involved. We are not talking to anyone else. We are trying to assess his decision making capacity. And despite being aware that he has cirrhosis of liver, if he still asks for alcohol in all his senses and in all his complete understanding of his condition, then we will be diplomatic and say that, yeah, we will talk to our team and we will come to a what do you say, complete answer on that. Yeah.
Okay, okay,
There,
perfect, perfect.
because he is पूरे होशा आवाज में he is asking, right? It's not that fumbling somewhere or he's not understanding something. So there,
So yeah, I got your point that like when you ask me like how to say a no to the family, would be
yeah,
definitely first I will have a conversation with the family and know their point of view, and after that then I'll shift to the patient, and while talking to him I'll assess his decision making capacity as well, right? And when he say if he says no, then that means a no for me. I have to respect the autonomy of the patient. If
yes,
he,
that's
if he says no, I want to have a hospice care, then I have to respect that. But in case he say over here, I would end my answer. But if he says no, I want to have a medical care, then I will have to approach the ethics, the hospital board, because there's no point continuing a medical care for somebody who doesn't have a good prognosis.
but if that's what he wants, then I think we have to respect his autonomy.
Okay, but I just think like we have to then approach the hospital boards or something ethics over there. Like if he wants like when he's at end stage and he is like he's eligible for the hospice care, I think we don't have to proceed with the treatment. But yeah, that's not a question. Like I won't talk about that. If patient says no, I want to continue with the medical care, I have to respect it. Then question end. After
Yeah,
that, if it's my bad that if he'll ask that no, he says I want to do this, then I can say that I'll discuss with my team, and whatever we
yeah,
will proceed with that. I'll be diplomatic after that. Okay, I got it. Okay.
uh, yeah. Yeah, I think your answers were all good, Ayushman. I was really impressed with. I mean, I'm not an assistant associate program director or whatever, but I was really impressed with your clinical experience in the US. You flew all the way from India to here to have, to complete 4 different rotations in different
And that
settings.
too, I never moved out of my house. It was my first time. In February, I traveled to Mumbai for the first time alone for my
Uh,
visa twice.
uh,
Is my biometric and interview were 15 days apart, so I didn't get that much off from my job. And this is my second time I was leaving the country for the first time. Like
wow.
I never traveled anywhere across the globe. I directly landed in New York alone.
This is that was really amazing. And you've had a very good mix of experiences. It's like outpatient plus inpatient plus procedural. That's a lot. I mean, yeah, whenever they ask you about cases, interesting case, conflicting case, or challenging case, or anything, yeah, encash on the part that you've had this tremendous US clinical experience. They will really like it because they will see that you can definitely fit into the system here. That's what they want to know.
Uh, Basically,
So
Samyukta, it's not like I have just prepared all these in advance, and all thanks to you guys. Like we used to have a regular meets, right? And where everybody come with a good ideas, and I use those ideas in my answer. So I'm thankful to
okay.
everybody out there who were part of those meets, and they used to get their opinions over there.
Just one more thing, Ayushman. I think when I asked you the differences between the US healthcare and India, that last 2 points I was convinced. The first 2 points I was not personally convinced, but if that's what everybody says are good, then just go with it.
They like you are not convinced that the patients, doctors, they get to spend more time because they don't have to see that much patients in US. Like you're not convinced by that point.
That can be construed in an uncomfortable way by the doctors here because they would be like, are you saying that we see less number of patients than it might be true, but
I
you
don't
don't want.
I like by that point, what I can say is that doctors in US they spend more time with the patients, and and compared to like patients have a lot of questions over here, right? So
Okay.
they have to spend, and the thing is, the US has definitely more doctor to patient ratio. Even that is something I used to listen to people answer, and then I just frame my answer that way.
Doctor to patient ratio is very true. Yes, we have a higher doctor to patient ratio in the US than in India. That is true.
That is why doctors get to spend more time per patient compared to that in India.
Okay.
That
Okay.
is like
Done.
my point. And the second point was the health literacy is variable in India. Like many a times, there are people with a good literacy and they are very much concerned about their health and they have a lot of questions. But yeah, definitely like you are worked as a gynecologist in India, and many times you come across the patients who have low health literacy and you have to convince them to take a treatment.
Yes.
And
Yes.
health literacy is comparatively high in US. Like people over there are well aware of their health and they want to take care of their health, right? And plus
Okay.
they have whenever we meet them, they do ask a lot of questions.
Okay.
So I just meant that way, but definitely I just feel the very important thing is that the structure that we have in US
Yeah.
and the structure we have in India, we don't have any structure. Though we have accessibility to the specialist, but like most of the people, they don't know which doctor to approach,
Hmm. Yeah.
right?
Right.
So that is something I like about the US compared to the India. That's just an opinion, nothing like.
Okay. Yeah.
So that I just meant that way. I don't know, like now, what do you think? Like it's fair enough to talk about these points?
Yeah, I think it's fine. And the last 2 points were so true about the waiting times here and in an
Yes.
emergency
Yeah.
that yeah. And it's more systematic here, more organized here.
Mm-hmm.
That's true. Yeah.
Plus, some people you have to just give me a benefit of doubt. It's not easy to speak in front of 29 people, right? Not doing a
Yeah.
meeting in front of 29 people is very tough. You feel very intimidated at times. You like, so like comparatively when you're doing it one on one, yeah, you just do it in I would say 1 or 2% better compared to what you're doing in front of like so many people. Like it's okay
Oh,
to have discussions, but
my God.
having mock in
Oh,
front of so many people
oh,
is difficult.
I'm so sorry. I'm really sorry. I did not have any this thing of putting you through all this. Actually,
No,
I
no,
did
no,
not.
that's fine. That's fine. See, that's adding to my confidence, right? I'm just saying, like, if I was wrong, like, you felt that somewhere I was lacking? That might be due to because I was speaking in front of so many people. So I felt a bit intimidated, right?
But awesome. You were really awesome. No, yeah, your answers were also very good. Actually, yeah, yeah. It was really nice. That's
Thank you.
all I can.
I just, I,
And good.
I'll try my best to improve more. Like,
No, you are good. You're good. Just stay the same. And good luck for the upcoming interview. And maybe research what their program is. And yeah, if you think, oh, I just asking the question that why our program. So just research the program strengths and let them know why you're interested in that particular program. And the part on research, they will touch on only if their program has a thing in research. Otherwise, nobody will ask you. Like out of the two interviews that I attended, nobody asked about research because they don't have research.
okay.
So that's it.
I just have one interview, so I'll try to give my best because I think everybody took a lot of efforts reaching this point of applying application and then preparing for the interviews. So we really
Yeah.
need to do good so that we get matched. Hopefully,
Yeah. And it does happen. It does happen that you go for one interview and you just match. It's like you see one girl and you get married and you're done for your life. So it's like that. It
so Samyukta,
happens.
I just feel I'm very jinxed at times. I'm a very jinxed person, so things don't go the way I want them to go.
Okay, but you're open to everything right now. So just stay open. It'll work
Because
out. Don't
I am a doctor back home, like I can get a job easily anywhere. That's the case with everybody, right? But still, being a part of the US healthcare system is a dream, and I think everybody has worked so hard to reach that point. So we just want to get matched. Just
you will reach.
say that I'm very open to any possibilities, but yeah, I definitely somewhere in the heart we want things to go our way.
Yeah, yeah. No, you will get it. This is what you want, so you will definitely get it. Yeah, pakka.
So anybody wants to do you want me to do a mock with you? Anybody wants to do a mock with anyone?
Yeah, anyone, guys?
I can do mock with anyone. Like I can ask you the questions. We can do a one-on-one mock if you're comfortable.